Assalamualaikum. I'm Siti Sufina, a student of Bachelor in Medical Imaging in Masa University, a part-time student, and my ID number is BMIP 9046664. Today I'm going to talk about stent graft procedure. Okay, what is a stent graft? A stent graft consists of two components, which is a stent, which is made by metallic to support the graft, and a graft is made by fabric to make sure that there's no leaking of blood through the aneurysm. We will seal the blood vessel at the aneurysm site so the blood will properly pass through the stent graft. Okay, most abdominal aorta happen affected at the portions of the aorta just below the kidney arteries and above the iliac branches. Okay, a stent graft procedure, which is less invasive, is done for endovascular aorta abdominal aneurysm repair. So in doing that, we need to have a few equipments, which is the endovascular repair set and an introducer sheet set and TR band to secure the hemostasis and EVR endurance 2S system graft stent, epidural set for regional anesthesia, PPE, personal protective equipment for the staff to wear, and a fluoroscopy to assist with the procedure, an ACT machine, activated clotting time, coagulation profile machine to check profile the activated clotting time for the blood. So pre-procedure, first step before the procedure, the doctor will check if the aneurysm can be treated or not, and whether it's worth continue with the aneurysm, which the aneurysm size should be around 5 centimeter. Then the doctor will evaluate the health of the patients, that mostly related to the patient's heart, lung, kidneys, and others, to make sure that it is not going to affect with the procedure. And standard laboratory blood test is done to exclude any anemic and infection, and also to know and to check the clotting time, coagulation profile. An ECG is done to exclude any cardiac arrhythmia. Echocardiography is to assess the size of the aneurysm, as well as the CT scan and angiography also, just to help with the procedure. So intraoperative procedure, preparation of anesthesia may use epidural or spinal anesthesia. And a stent graft is an endovascular aneurysm repair that introducing a stent graft over the artery in the groin of the patient. A doctor will make 2 small incisions at the groin using X-ray guidance, and after that the doctor will insert the delivery catheter in the artery in one of the leg and carefully position the trunk position of the endovascular stent graft across the aneurysm region. After the stent graft is confidently determined in the correct position, then the component of stent graft is released and allowing it to expand to the diameter of the aorta. Then the delivery catheter is removed, leaving the stent graft. Okay? The procedure is repeated on the other legs to place the contralateral leg component. It is by feeding the trunk and contralateral leg component together inside the vessels. The aneurysm is now sealed by the endovascular graft. After the doctor has confirmed the proper placement of the graft, both left and right side, then and ensure the blood flow has been flowing through the endovascular graft properly, not leaking to the aneurysm anymore, and 2 small incisions are closed, and the 2 small incision is closed by small suturing. Okay, pre-removal of the femoral sheath, activated clotting time should be checked, okay, before the removal. Then post procedure, patient will be put in the recovery room for 4 to 6 hours to allow the legs from being swelling and to protect it to be from having hematoma. Okay, and then patient can be admitted about 2, 3, 4 days in the ward, depending on the consultants, on the doctor's suggestion. when the doctor has made up their mind to discharge a patient, the doctor should give periodic assessment, periodic follow-up to the patients to monitor the success of the treatment. And patient can be back to normal activities around a few weeks, 1 to 3 weeks. They can be on their own as with the abnormal activities, and that is better for the patients and not taking a long time for them to recover. Thank you very much.